chakra meditation. So the heart chakra just involves with self-love, the love that you put out into the world, and I feel like this work that you all are doing is a labor of love. So I wanted to just make sure that we set the intention for love today. So one of the first cards I pulled says, I am a source of abundant love. I am a source of abundant love. So I just invite you all to close your eyes in this moment. We're going to get present with our breath. So just inhale through your nose. 3, 2, 1. Hold for 3, 2, 1. And exhale for 3, 2, 1. Let's do another breath. Inhale for 3, 2, 1. Hold for 3, 2, 1. And exhale for 3, 2, 1. One last breath. Inhale for 3, 2, 1. Hold for 3, 2, 1. And exhale for 3, 2, 1. Just let all the stress be washed away by the sound. Whenever you feel doubt creeping in, just remember that you are a source of abundant love. And when you're ready, just begin to return to the present moment. Just wiggle your fingers, wiggle your toes, and slowly open your eyes. Coming back to the present moment. We're gonna pass it off to Gabriella and get our day started. I just want to say thank you all for meditating with me these past few days. It's been so good to start my mornings with you all, and I hope that this last day is very fulfilling for you all. Thank you so much. And Gabriella, take it away.
Thank you, by Hayes. Good morning, everybody, and welcome. Today we'll be providing interpretation at this session. I will be making this announcement in English and Spanish. Bienvenidos, vamos a proporcionar interpretación en la sesión del día de hoy. Voy a hacer este anuncio en inglés y en español. We invite everyone to please select English if you are a monolingual English speaker. This way you will be able to hear any comments in Spanish. I don't think that's going to be the case in this session, just in case. Presenters, please remember to speak at a moderate pace because we do use 30% more words in Spanish. If you are in your computer, at the bottom you will see a globe that says interpretation. Put a check mark on your preferred language. If you are on your cell phone or tablet, locate the 3 dots, tap it lightly, and put a check mark on your preferred language. Be sure to click Done in order to activate and begin the interpretation. Friendly reminder, if you see the interpreter raise the virtual hand on Zoom, please make sure to speak slower. Invitamos a todos a seleccionar el idioma español si usted es una persona monolingüe en español. De esta manera podrá escuchar a las intérpretes. Si está en su computadora, hay un globo terráqueo en la parte inferior derecha de su pantalla que dice Interpretación. Ahí podrá seleccionar el español. Selecciónelo con una palomita. Si está usando su celular o tableta, ubique y toque los 3 puntitos ligeramente y ponga una palomita en español. Después seleccione Done o Finalizar. Este paso es muy importante para poder activar la presentación. Thank you and have a great panel, everyone.
Okay. Hello, everyone. My name is Afia Atamensa, and I serve as the Chief of Programs at Community Change. And Community Change, we are an organization that seeks to build the power and capacity of low-income people, especially low-income people of color, to change the policies and institutions that impact their lives. And I have the absolute pleasure to be the facilitator, guide to this dynamic panel today. And I know so many of you have been part of this amazing conference that Community Catalyst has put together, have had the privilege of hearing from dynamic organizers, policy experts, movement folks across our amazing health equity movement to show all the different facets of our expansive and beautiful movement. And so I am really excited for our panel as we talk about how power is moving through the health justice landscape in this iteration. And for me, power is about action, right? It's about how we are able to move an individual or institution to action. And the folks who are part of this amazing panel today are absolutely about action in their work, in their vision, and in our goals. So I want to bring forward our panelists to be able to introduce themselves and for us to be able to get started in what I know will be an amazingly powerful and introspective conversation. Natalie?
Hi, good morning. I'm Natalie Burke. I'm President and CEO of Common Health Action. And more importantly, I am Irma's granddaughter and Joan's daughter. And so I stand on their shoulders and I walk in their footsteps. I am President and CEO of Common Health Action. We're a public health organization, and we exist to develop people and organizations to produce health through equitable policies, programs, and practices. Thanks.
Thank you. Lee?
Hi, everybody. Happy Thursday, and it's great to be here. My name is Lee Storo. I currently work, as the Senior Director of External Affairs at Community Education Group, otherwise known as CEG. CEG's focus is on attacking and working around the syndemic of HIV, viral hepatitis, and substance use. We're working at a national level, but have a particular focus in the South and in Appalachian states. Prior to coming to CEG, I had the honor of leading a state-level organization focused on HIV in North Carolina, and over the last decade have really looked at both at a state, regional, and national level about how we combat disparity in LGBTQ health, HIV, and other infectious disease. Really excited to be here and honored to be part of this panel this morning.
Thank you. And Brianna?
Hi, everyone. It's such a pleasure to be part of this panel. I'm Brianna Lipscomb, she, her pronouns, and the Senior Advisor of Maternal Health and Rights for the Center for Reproductive Rights. I'm also the acting lead of our U.S. Human Rights team. I was born in Mississippi. I live in Georgia. I consider Tennessee home, and I've lived in Alabama, South Carolina, and North Carolina. And I share that because I am Black and Southern to my core, and that leads the work that I do in the maternal health rights and justice space. And so in my role at the Center for Reproductive Rights, I do policy work with our maternal health and reproductive health and justice partners. We advance proactive maternal health policy at the state level. I also do significant work at the federal level as well. And I'm currently in Geneva, Switzerland, talking to folks at the United Nations about how the government has failed to uphold its human rights obligations to birthing people and people with the capacity to birth in the US. So I have my hand in kind of every facet of advocacy related to maternal health, and I'm excited to discuss it a little further today. Thank you.
Woo, I told y'all it was a heavy hitter panel. Listen, let's get into it. Brianna, sis, I'm gonna start with you. We're gonna go in reverse order. I want you to talk with us a little bit about what you view as some of the biggest threats and challenges facing people impacted by health equity.
Yeah, it's an interesting question. And if you had asked me this question about a week ago, my answer would probably be different. I think the expectation is that I would say it's the retrogression in reproductive rights that's one of our biggest threats right now. And I still think that's true. But a similar question was asked of me as we were talking to some folks at the UN. And what really got at the core of it was the person asked, how do we get to a place where in the United States, a progressive, well-resourced country is able to roll back reproductive rights protections? We're able to have the highest maternal mortality rate in any wealthy country. How does that happen? And really what it took me back to was how big of an issue voter suppression is. And I think that this is going to speak to maybe some other conversation we can have later about cross-movement issues. But when I think about the way, particularly in the South, particularly in the Midwest, that state legislatures have been able to change laws despite what the majority of the folks in their states want to see happen, despite the fact that they've said we want access to this care. It's because they have been very successful in suppressing the vote. They're able to draw district lines the way that they want to make sure that the control at the Capitol looks a certain way. And so that should be a big concern to us, is how is our voting power being restricted? And then how is that resulting in drastic changes in policy that don't reflect the people that are in these positions of decision-making power are able to make? And we see that anywhere from the state legislature to Congress, all the way up to the Supreme Court. And I think that we need to continue to be extremely concerned about the way that that is playing out and really creating this rollback in our rights.
I appreciate that, particularly bringing front and center the issue of voting rights. As you are well aware, for far too long, there has been an attempt, or frankly, some success of trying to force us, right, to make small the issue of health equity or in fact, health inequity, as if the issues are narrowly about being able to walk into a doctor's office or walk into a hospital, but it's larger part of these bigger interconnected systems. I just truly appreciate that and want to lift it up. Lee, same question, threats and challenges facing people impacted by health inequity.
Yeah, I mean, Brianna, what you just said about voting rights, I think is so critical to all of this work, right? Because if we don't have people making decisions who reflect their states, who reflect their communities, we will never create the world that we think we can create. And I'll tell you, this is actually really front of mind because North Carolina, my home state, released new congressional maps about like 12 hours ago, right? So my people, our folks in North Carolina, are analyzing this. We are likely to go from a congressional map in North Carolina that currently has 7 Democrats and 7 Republicans, which is pretty reflective of the state, right? Like North Carolina, smack dab in the middle, purple state, to a delegation that's likely 3 Democrats to 11 Republicans. That does not reflect what the people of North Carolina look like, and it's going to impact every single decision made about health policy and health inequity for the next decade, right? And then we kind of get stuck in the cycle. I think when I think about the threats and challenges of the last couple years, right, it just seems like every other month something's changing and we're taking a step backwards. And what's sad to me is I think that in 2020 and 2021, the threat of COVID became so oversized that we actually started to do some things that helped address all these other health inequities, right? We had the political willingness to just say, you know what, like people need a little extra cash in their pockets and we're just going to send people checks. We are going to put down all these barriers that get people off Medicaid, right? We're going to have the expanded child tax credit. And that had a lot of positive outcomes, not just around COVID, right? We had all these positive health outcomes in all the other spaces that we see inequities. Far from perfect, right? Like, don't get me wrong on that. Far from perfect. But we started this like emergency, let us build a world that helped fix some of these things. We've been in an emergency when we talk about health in the LGBTQ community and communities of color in so many communities across this country for a long time. And I feel like we've just, now that the COVID emergency is over, we're losing all of those protections that helped keep people healthy and live the lives that we all want to live.
Thank you, Lee. And Natalie?
So many threats in so little time. So I will start by saying ditto to everything that was said prior to me. But in addition to that, I think the lack of connection, integration, and collaboration between healthcare systems and public health proved to be an enormous problem throughout COVID. We have to figure out a new way for those systems to work together effectively if we want health equity to ever become a reality. And that means that we have to make some real investments in workforce so that they have the knowledge and the information necessary to engage meaningfully. So for instance, there was a recent study talking about the fact that most hospital workers cannot define health equity. Like, how is that okay? That's not okay. We have real work to do if they are going to be partners in the production of the public's health. And so to some degree, we've got to create some porosity of silos. We have to make funding porous enough to allow for the flow of dollars back and forth between and through healthcare and public health, so that decision-making can reflect a more integrated approach to the way that we seek to produce health in communities. But in addition to that, I think there is something that is far more fundamental, and you all bear with me because this is really sort of going way far fundamental. Whether or not you believe it, human beings are actually hardwired for fairness. Brain scientists say that because of how early humans lived in relationship to one another, that our brains are actually hardwired in such a way that when they do studies with babies and they actually do tests with them, their brains light up when they see conditions that are fair and that are equitable. Now, that was generated by living with a high degree of interdependence. And I've been thinking about this a lot. We have, in a very clear way, dismantled our interdependence as society and as communities. And I believe that that leads to a place where our brains no longer light up for equity the way that they should have. I sit and I marvel at the fact that today I can have food, a basic human need, and never know where my food was grown, who planted it, who put water on it, who harvested it, who transported it, who processed it, who cooked it, who actually delivered it to my house. I have contactless delivery. If a basic human need can be met without human interaction, then why is my brain going to light up for fairness anymore? And I know that that's sort of going way far afield, but I think that we have to begin to deal with these issues of human connection and interaction. We have to explore and redefine what community looks like so that we actually structure communities in a way that interdependence is a foregone conclusion and it's not seen as though it's a burden, but rather it's how we function together. When we can do that, the way that we value each other will drive us towards saying that health equity is not an option. It is absolutely the only way that we can live in relation to one another. So for me, I think it is critical for us to think about how do we redesign our communities and our relationships to support the outcomes that we want to have.
This is great. So let me just say, our next question is about strategies and recommendations for addressing these threats. And let me just do a bit of a summary of what I heard, right? So from Brianna, we heard about the voting rights and the gerrymandering, and dare I say hyper gerrymandering that we are re-experiencing, particularly communities of color at the local, state, and federal level, that allows for this manifestation of our current Supreme Court and a rollback of reproductive rights. From Lee, we heard both about this during the pandemic, that some of the falsehoods that were told of barriers to us about the policy imperatives that we know impact can make people's lives better, like the child tax credit, like actually putting cash money in people's hand and allowing individuals, believing them that they can make the day-to-day decisions about what's needed for themselves and their families. And we heard from Natalie both about a lack of intersection with public health systems and healthcare, private healthcare systems, but even more broadly, a drive of isolation, right? As opposed to the interconnectedness that we all need that will allow for equity and a moving towards there. So this is a lot, and all of it makes my health and my heart sing, because I want to just kind of shout in solidarity with you, because I think so many of us are there. And so I want to change the question a little bit from strategies and recommendations that you individually have, because these are not issues that you all have to bear alone. For us to actually make change within these systems, we have to do them together. So what I would offer is, what are strategies and recommendations that we can have for addressing these threats together? And I want to start with Lee.
One kind of theory, and it's a little narrow, but I think it's helped my mind expand over the last couple of months, that we've been talking about internally at CEG, is sort of some arbitrariness around state lines, but how that's also symbolic about how a lot of us do our work. Our focus is Appalachia, and we have a close partnership with a federal government entity called the Appalachian Regional Commission. The ARC region covers 13 states and portions of almost all these states, right? Broad region from rural New York all the way to northern Mississippi and Alabama. And they recently put out this massive funding stream that said for the first time, we need to break state lines, right? If you live in, Appalachian, Kentucky, you likely live, work, and play in West Virginia, Ohio, and Kentucky, right? And like this nature of a state boundary doesn't impact your life. And that's not just true for Appalachia, right? You live in New York City, there's a chance you live, work, and play a little bit in New Jersey, right? We could give a lot of examples of this. And I think so many government streams have resulted in nonprofits, organizations, coalitions that like exist around these state lines. When we were working on Medicaid expansion in North Carolina, we talked about for folks who live near Danville, Virginia, there's a lot of North Carolina residents who live along the border of North Carolina. They may drive over the border to Danville, Virginia to work and are employed there and then come home. And if they lived literally 5 minutes up the road, they would have had Medicaid a decade ago. And so we've been really playing and thinking about this theory of just breaking all the silos, right? I know, having listened to part of the conference, talking about the intersectionality of our movement and how we break down those movement lines and bring all of our issues together is true. But I also think about how, we have so many siloed state organizations, right, who don't always, I think, reflect people's day-to-day life. And I think if we can start as a movement kind of playing this long-term strategy, but thinking differently about boundaries, and that's the physical boundaries of a county, of a state line, but also within our organizations. I think that's one sort of long-term vision. May not be a specific tangible strategy, but I think a framing that could get us better outcomes in the long term.
Thank you. Natalie?
So a number of things. I think one is in the work that we've done in communities, we are often encouraging them to stop preaching to the choir. We're already there. We already got it. And begin to push into spaces and have really difficult conversations with those folks who are not on board. And the only way that you can do that effectively is to do it and keep doing it. It requires practice. To be really honest with you, it's a set of muscles that you have to develop to figure out how to reframe what seems so obvious, what seems so basic to humanity, to say, why don't people get this, right? And figure out how to reframe until it resonates, because we have to get a critical mass of people in order to be able to tap into the power necessary to change outcomes. Power being the ability to define reality for yourself and for others, right? That's a critical component. I think another piece is that we really need to rethink and reframe community power. And I know that's been part of the conversation. I get frustrated when I hear people say, oh, community should have a seat at the table. What? Community is the table. But if we keep talking to community people and organizations and saying, yeah, you need a seat at the table, that's their mindset, right? They're not recognizing people should come to them. It's their table, right? That's where it belongs. That's where the work belongs. That's where the power belongs. That's where the decision belongs. And everything that we do has to really be focused on recognizing that communities should be able to determine their own health destiny. So in order to do that, there are a number of things that come to mind for me. One of them is that we have to begin to drive a narrative all the time. Those of us who get to operate, whether it's in spaces that are 50,000 feet or in spaces that are on the ground, we can't just put out narrative when we have a specific intent or there's a specific piece of policy. It has to be ongoing. Look, you all, whether I need Q-tips in my house today or not, I'm going to see an ad for Q-tips. You all get what I'm saying? It's constant. Whether I'm going to need Kleenex, I'm going to see an ad for Kleenex. It's constant. That constant method of strategic communication gets me then to engage in a behavior. If we want communities, policymakers, power brokers, if we want people to show up and vote, it's not just right before the election that narrative needs to be driven. That has to be imprinted on the DNA of the communication of our society. And we are able to communicate through all of these mechanisms. We have them handy, so let's use them, right? So driving narrative becomes really important. As a part of that also, then, we have to establish common language and use it. If I hear one more person say health disparity, I'm going to throw something. We're not talking about health disparities. We're talking about health inequities. The opposite of health equity is health inequity, not health disparity. If we can't name a problem and define it, then we can't fix it and we can't change it. And so we have a responsibility to curate the language and to curate the narrative and to curate the relationship and the placement of power that's going to lead to the health outcomes that we feel we need to have in the world. And quite frankly, because we've been living, I think, so much in survival mode and in response mode, we haven't created the space necessary to do those things proactively and strategically. But one thing I'm very, very clear about, we have not yet gotten to the tipping point in terms of critical mass to make health equity a reality. And that means, I have a t-shirt that says Equity Evangelist. Sometimes when I go out and I speak, I will wear the shirt that says Equity Evangelist. We have to become equity evangelists. We have to be able to translate this message to audiences, not just to convince them, but so that it is meaningful for them. Because then at that point, I don't have to do anything else because they're already plugged in. But we haven't done that work well yet. And that means stepping out of the confines of what's comfortable. I have found myself in spaces with some people I would never have thought I would have been in spaces with. And that's absolutely okay. I survived it and I'm still here to talk about it. And I'd like to think that I have won some friends, influenced some people, and changed some hearts and minds. And that's the last piece that I'll say on this. Perspective transformation is a critical piece of this work. Perspective transformation is an adult learning theory from Jack Mezirow from the 1970s. And basically, the easiest way to say it is when people know, think, and believe something different, they will decide, behave, and act differently. If our work is not compelling people in that way so that they will decide, behave, and act differently, health equity is not possible. So we've got to strive for perspective transformation, and that happens by tapping into head and heart. Just telling people it's the right thing to do, fairness, justice, the people united will not be defeated, is not enough. Using facts and data to say it will cost us less money, fewer people will die, that's not enough either. We've got to marry that up to make an argument that is relevant and sustainable. I'm gonna stop there because I'm getting carried away.
No, listen, it's Thursday. You go on and preach right now because you got me on the decide, behave, and act differently. I'm about to carry that with me all week. Sister Brianna.
Yeah, no, I think Leah and Natalie really shared some great strategies and ideas and ways for us to rethink how we're approaching our issues. You know, one thing that comes to mind for me is, you know, allowing ourselves to think outside the box. And so I say that because I'm deep in the policy work, right? Like I'm constantly talking to legislators. I'm constantly working with partners to get them in front of legislators so that they can talk to legislators. And then I'm also thinking about, we do that constantly and then watch legislators make decisions without any consideration whatsoever of what we have asked of them, right? And what it makes me think about is, I want to say over the past year, since the Dobbs decision, which is a Supreme Court decision that overturned the Roe v. Wade decision, there are 6 states that put abortion on the ballot. And so basically it allowed the residents of their state to vote whether or not, I mean, it varied from state to state, but essentially it gave the residents direct power to decide, do we want to create protections for abortion? Do we want to push back on retrogression in abortion access? And every time abortion was put on the ballot and allowed the residents to vote, abortion won every time. And I just think about how we allowed ourselves to get in this cycle of this is how you change policy, and these are the steps that we have to take, when there may be other ways for us to get the win, for us to get what our communities need and what our communities have been asking for. And so when I think about this strategy, I mean, obviously everything can't go to the ballot, right? But I just think about allowing ourselves to dream and allowing ourselves to imagine and to to rework how we are approaching the issues and how we decide to go about it. And so I think that would be my strategy, is maybe just pausing and saying, is this same way that we've been doing things for the past few decades, is that still working for us? Was it ever working for us? Or do we need to come up with a different strategy? And I also will say ballot initiatives are expensive and require extreme coordination. So also don't think that it happens extremely quickly, because it takes planning, but it's also possible. And so I think just allowing ourselves that time and that space and that freedom to dream about a new way of doing things, I think could be really powerful.
I so appreciate that. I want to bring in, Lee started with this, and each of you have touched upon this, kind of this arbitrariness of lines, right? This arbitrariness of boundaries, be them in states that don't serve us. And we see that same type of, at times, self, or if we're honest, system-imposed arbitrary lines in our movement, right? The old framing of healthcare and health justice work being about, as I said, access to care, as opposed to voting rights, as opposed to ideas of putting cash in people's hand and child tax credit, as opposed to interconnectedness. And, I want to bring our dear sister Trey Manisha in this when we were talking about this early. The movement requires us, as you're saying, Brianna, to think differently, right? Like winning requires us to be bold and audacious in our ideas. And that doesn't mean everyone has to do and be experts in everything, but it means we have to be equal partners in this thing called breaking oppression. And so it requires some risk, as you talked about, Natalie, being in different spaces with folks who you may not have thought of. And so with that, I'd love to hear each of you talk a bit about, and Natalie, I'll start with you, just some examples you have of how you have had to work across network systems and movement to build power and create change. And if we could, some radical candor about what lessons you learned and what was hard, because to your point, Brianna, sometimes I feel it's not quick and it ain't easy. It is not sexy at times, but it is essential, this work of getting free. So I'd love to hear you all speak with a little candor and vulnerability about some examples and what you've learned. And Natalie, I'll start with you.
Thanks. So one of the things that I've had the blessing and the challenge of doing is actually developing, envisioning, dreaming the Culture of Health Leaders program that was funded by the Robert Wood Johnson Foundation for the past 7 years. And we've had 200 leaders from throughout the country, from different systems, institutions, and disciplines to go through that program, and each of them participating for 3 years and doing amazing things. Now, a couple of things that I will tell you was challenging along the way. One is that we had created cohorts that were some of the most diverse that the foundation had ever seen. Leadership programs coming out of the foundation at the time we started this traditionally trended towards being white and being male and being very academic. We wanted to reach people who were not from those spaces, and frankly, made the foundation inherently uncomfortable because we brought in leaders who were being funded to participate in this program who questioned the very existence of the funder to their face in the board meeting. And so that level of discomfort was something that, as a leader and as a National Program Center, we had to figure out how to make that work. But the other thing that I don't know that I anticipated going into it, and I don't think our team anticipated it either, when you bring together leaders who are about the business of health equity and who are passionate about it and who are called to do it, they have a calling, right, to do this. It's not just a job. They didn't just get hired to do this. They sought this out because they are called to do it. They are deeply committed, highly intolerant, generally pretty vocal. And we had to figure out what it meant to create spaces for them to be able to engage with one another in ways that were challenging, hopeful, meaningful, and that would actually produce something. And part of what I learned was, first of all, every leader is different, just as every community is different, right? Our job was to create space where we could, to respect their differences, but also to push them. Because here's what we started to recognize. We had folks who were very activist minded. They live to throw the wrench. They want to break something. They see something in the system that's wrong, and their job in their mind is to break something. But often those leaders didn't consider what came next, right? And so we had to push them to be able to have those conversations when we are tearing down systems and institutions that either were not designed with certain people in mind, or actually were designed to block out certain people or to harm certain people. When we break them, we have to begin to have a vision for what happens next, okay? That meant that as cohorts, as 200 leaders, we had to have a lot of really difficult conversations about approaches. And so this is to get to my point. A lot of times in doing health equity work, it is easy to throw shade on somebody else's approach. It is easy to say, you are not tearing it down, or you are working with the man, or to say, inside game is not a part of creating real change. The only way that you can do this is by operating from the outside. Or those people operating on the outside are making too much noise, creating too much dissension, right? And that's not how real change can happen. They have to tap into internal power. What I'm asking you all to do, and the way that I spoke to our leaders, the way that we engage and work in communities, is that equity calls on us to recognize that you can hold all of that as true at one time. Just because somebody is taking an approach that is different than yours does not mean that it is wrong. And so what I would encourage people to think about is, how can you look at your work, whether at a community level or as an organization, and see the ways in which sometimes it may require inside game and sometimes it may require outside game, right? How might your work have to be different in order to get to the outcome that you intend to have? And that means that we have to be multilingual in the sense of being able to appeal to many different audiences, use many different approaches, and be humble. Be humble. There's something to be learned from people who operate in spaces differently than the way that I might or you might. And so for us, the key was, how do we create spaces to have those difficult conversations and to be receptive that there is more than one way to get to health equity? And I think a lot of times that becomes a real challenge, and it's part of what works against collaboration, especially at a community level. And it really then leads to people sort of isolating themselves and saying, if it's not this way, I'm not doing it. We can support each other's work and we can support diverse approaches and still be impactful.
Thank you. Brianna and then Lee.
Yeah, so I was just thinking about the different ways that we've been trying to work across movements and across issue areas, particularly in the reproductive health rights and justice movement. And I think, reproductive justice in and of itself requires that of us, right? Like, it's an acknowledgement that people do not live single issue lives. And so for us to approach any of this work in that way is antithetical to reproductive justice in that movement. And so when I think about, some of the ways that we do this is, one, being more intentional about, I think it was Natalie that brought up like the language that we use. And part of that is also not making assumptions, right? So we have been trying to be more intentional about working with folks in the disability rights movement, LGBTQIA plus movement. And what's important, I think, is for us not to say, oh, because I read this one article, these are the words that we should use in this paper or these things. No, why don't we actually engage our partners in that space and figure out how can we collaborate on messaging and, whatever it is we're trying to put out, bills and things like that, to make sure that we are presenting policies that are meeting everyone where they are and making sure that we're keeping everyone's wants and needs in mind when we are trying to affect change. And one way that this really played out a few years ago is we partnered with folks in the Rio Grande Valley down in Texas, when there was an issue where the Texas legislature, there's no into the barriers that the Texas state legislature creates for access to reproductive health care. But a few years ago, they severely slashed their family planning budget. They were making it very difficult for providers of reproductive health care to deliver that care. And this was directly impacting low-income folks. And then you couple those policies with some really strict and severe federal policies on immigration, and then of course just stigma and everything else that is the case with many folks in Texas as it relates to immigrants. It was creating a very hostile environment for people to access reproductive health care, specifically contraceptive care. And so we partnered with folks in the Rio Grande Valley to talk about access to reproductive health care, but there's no way we could have that conversation without also talking about immigration policy, right? And so it's this acknowledgement that we can't achieve one if we really don't address this other issue as well, and being open to using our resources to address issues that may not necessarily directly line up with what we think we're supposed to be working on, and then making space to have those conversations, and then also to educate lawmakers and other community members about how the two are so closely linked. So I guess just kind of going back to the original question of like how we do that, I think once again, I'm all about like pausing before we just jump headfirst into whatever an action is, and making sure that we're considering what are all of the other issues that may be impacted by our decision to move in this way, and are those people at the table to have a conversation, because the last thing we want to do is to achieve what might be perceived success on reproductive rights. And in the process, we have now made it more difficult for folks in the queer community to access reproductive health care, or we've made it more difficult for clinics to serve folks that might be differently able. So I think it's really important for us to think comprehensively and holistically about our work. And we can only do that if we are actively having the conversations with folks from other movements.
You know, I wanted to talk, when you sort of posed this question, a little bit about thinking about base building, right? And how we do that work 12 months out of the year, right? Not just in elections. I may end on a note about that, but Natalie, like a couple of things you said really resonated with me. And if, you know, this question and for this conference and this conversation, right, is our strategies and movements, I think this tension within sort of the progressive health movement around sort of the inside the baseball game versus outside the baseball game strategy, like we got to keep grappling with that and I don't know that we ever have to come to consensus, right? But I think it's one that's been a tension through my work for a long time. Natalie, you said, and it really resonated with me, you know, there are some community members who think inside game is not real change, right? And my work has done both, right? In my time in the HIV space, I have always believed that we need to protest in the streets, right? We need to radically push as far as we can. And like there is a job for someone to go inside state legislatures and talk to Republicans about HIV. And that's, you know, candidly, like the work I did for 7 years in North Carolina was to talk to primarily straight white men about why they should care about LGBTQ health and people who use drugs, right? Because that's how HIV is transmitted in North Carolina. And there were activists who said basically, like, you should not do that, right? The North Carolina state legislature is a flawed institution. It's a racist institution. It's homophobic. They're created by gerrymandered problematic lines. I agree with all of that, right? But like at the end of the day, like the right is there, right? Those who oppose the things all of us care about are showing up every day. And I think we do have to have a movement that's strong enough to do both, right? And we need to, you know, if I was the person going to the state legislature to talk about LGBTQ health, I also needed to go do the far progressive work in the streets, right? And the base building and bring, I think we really can do both. And unfortunately, I have experienced, I think at times that infighting, right? Of sort of, we're almost spending more time disagreeing on strategy if this coalition wants to go one way and this one wants to go another, when we're like so close, we agree so much, but we're infighting with each other instead of trying to figure out how we can at least pull some folks from the other perspective to our team. And it's tough, right? And the reason we're having this fight is the whole system's broken to begin with, right? And it's like forcing us to make these flawed choices. So I could go down this road for a long time, clearly. I think actually, if I could, to circle back to what I thought I was going to talk about, I think the way that we do kind of fix this in the long term is we base build 12 months out of the year, right? Like, let's stop hiring organizers to go to swing states 90 days before an election and work like 80 hours a week and talk to people they've never met in their lives. And instead, like, let's hire people to be organizers 10 hours a week, 12 months out of the year, and let it fit into their lives and organize their own neighborhoods. I actually do think that's how we create sort of the long-term system. And it's going to take a long, long time. But that's how we, I think, really change who's in power and change the systems to get better outcomes for all of us.
So before I get to this last question, I want to make sure that our folks who are here and with us in this virtual space are getting their questions ready. I know we've been left with so many amazing nuggets and things you all want to make sure that we can dig into more. So get your chat hands ready and start putting them questions in the chat box so that we can get to a Q&A session. But before that, and Lee, I'm gonna start with you because you're going down a path that speaks to my heart as an organizer. I believe that lives are changed through individuals taking collective action. And so this idea of organizing a base, not as something that is a prop, but the actual change will happen as people transform and learn that their action can change things, that they can see and hear stories that demystifies the deep shame that we've all been taught to feel, right? Be it about health issues, be it about reproductive, be it about all these different types of things. So I'd love to hear a bit more from you and from Brianna and Natalie as we're paring down this panel about some messages you have on our path forward to health justice. Like, what would you say about what that should include, right? Like, so what's a clear message on our path forward to health justice? What should that include?
You know, I think the best example of some of the work that I'm most proud of was at NCAID's Action Network. We had a small network in Eastern North Carolina based in Greenville, for any North Carolina folks who might be listening in, called the Women's Empowerment Team of the East. It was a group that was primarily African-American Black women who were living with HIV. And their work like started with a monthly support group, right? That was just sort of talking about the experience of living with HIV, right? Grappling with their health issues and challenges and the deep stigma that especially in a rural part of the state you felt. And over time, the program evolved to say, for those comfortable, we want you to come to the state legislature with us, right? And share your story at our annual advocacy day. And then, you know, we were a 501c3 organization, so not doing any partisan political activity, but we're just going to knock on doors in local city council elections and off years and tell your neighbors that they should vote and make sure they know where their polling site is, right? We weren't, again, no candidate stuff, right? Nothing to that point. There's a lot of research, but I feel like I saw this in real life, right? Like that if you're someone living with HIV, and I think this translates to a lot of health issues, you know, the experience of getting to publicly talk about it builds your own sense of self-worth. It breaks down isolation. And then if we can move you, and if you're comfortable with this, up that ladder of engagement to be an advocate around that issue, like that's a stigma breaking tool, right? Like feeling like you can write a letter to the editor about why this is an issue in your community and feeling comfortable to do that publicly, like is such a win for self-worth, for all kinds of things around health outcomes, and for being a stigma breaking barrier. And again, I think this gets back to what I was talking about earlier, right? So instead of like me, right, like nonprofit professional from Raleigh, driving out to Greenville to knock on doors and tell people to vote, we had people who like actually lived in that neighborhood go talk to their neighbors. And I a couple times went out with some of the folks in the We team, and it was just like, I've knocked on a lot of doors in my life, right? I think that I bet this panel and the 150 people we probably knocked on like 1 million doors or made 1 million phone calls, right? It was like the time I saw how base building worked, which was when you have somebody who lives in the neighborhood go talk to their neighbors. Don't like bus people in, right? Like pay people to do that work and let them do it on their own time. That kind of project, right? When we think about health and equity and what that did for both the members of the We team, but their community and their neighborhood, is what I'd like to imagine for all of our projects in the future.
Thank you, Natalie, and then Brianna. And Brianna, excuse me, and then I want to remind folks to get you know what I'm saying? Start stretching them out now, get them fingers ready for the chat, because I want to get some questions from you all in.
So, okay, for me, one of the toughest things in my work over the past 25 years has been going into communities. Like, for instance, we worked in Mississippi for 4 straight years and provided support to 103 grantee organizations throughout the state, and really seeing the struggles and the challenges that they face because of the funding model associated with their work. On a personal level, I have deep issues with the fact that the work of humanity is categorized as charity. The work of humanity should not be charitable work. Okay, so I'm just gonna throw that out there. I'm very tired of seeing people who are fighting for health justice barely able to pay their bills and take care of themselves. And we need to begin to cultivate a next generation of leaders who recognize that they deserve to be financially viable for themselves and for their families, and that they deserve to be healthy, whole, and well. Okay, so if that is the attitude that we want to invest in, so that folks can have longevity and resilience and actually model what we want to see in everybody's lives, right? That means that we have to rethink how we fund the work of health justice and health equity. So people have heard me say this before, I keep getting myself in trouble, but the reality is, in America, 83% of philanthropy happens from individuals, 12% of philanthropy happens from foundations, and 5% of philanthropy comes from corporate entities. We are all being crabs in a barrel for the most part, those of us working in the nonprofit space, over that 12% that's coming from foundations to a large degree, and some government dollars as a separate situation. That type of funding is a plantation model. And so what I mean by that is, in a plantation model, enslaved people would go to the back door to get the chitlins and to get the greens, but they would never get the pig and the seeds. We have to begin to think about, what does it look like to fund the work of health justice in perpetuity? And for me, what that means is to push the boundaries and to make uncomfortable those entities that hold the purse strings, to the point where they start to consider what it looks like to endow community-based organizations to do this work in perpetuity. So I'm actually going to just give this and put it out there, because this is a piece of my work that I'm developing. And at this point, I don't care, everybody needs to think this way. If you are a community-based organization and you have a funder that says, here's $100,000, what if they were to say 50,000 was for programming, but 50,000 of it, we're going to have you to work with our investment folks so that you get to invest it and get a rate of return of 13%, 10% per year, which is what their investments usually do for them. Imagine what that would mean over time to be able to draw that down for core operating capacity, so that you can decide in concert and in collaboration with your community what you want to focus on, not what the funder says is important, not because the funder says work on a thing with kids, or work on the things with violence, or work on the things with food, but rather because your community says right now this is what is important. If your organization has the resources to do that, you then get to determine your own health destiny. So why are we not thinking about changing the funding model so that organizations can be self-endowed? Can you imagine the amount of power Power being the ability to define reality for yourself and others that would come through that, as opposed to living check to check, hand to mouth, grant to grant, right? Grants that don't allow you to capture any kind of unrestricted dollars, right? That you can have, in the bank that you can use for something else. They don't want you to be able to do that. They don't want to allow you to do that. And so in that, that's one part of it. And the other piece that I will say very quickly is this: if you are a part of a nonprofit entity, you should have a for-profit stream of revenue. You are allowed to do that, right? And so grants don't need to be the only way that you bring money in-house. So when you say, if I wanted to leave a message about a clear path forward for health justice work, we have to make it sustainable. And that means that we have to make how we fund it different. We have to begin to think of the business model behind it. And that is about more than charity. And that is about making sure that the people who are leading this work survive this work. I am tired of seeing people burn out, lose their homes, have their families fall apart because they're trying to save the world, but nobody is coming to save them. We have to do better. And to me, a big piece of that is changing how the work is funded.
I mean, that's a mic drop moment, right? Like, I don't even know how to follow that. I mean, I think Lee started talking about, the community voice, right? Trusting communities to lead their own communities on their path forward, right? And then Natalie talked about, how do we make that work sustainable? I don't know that there is more to add. Those are the two critical pieces that I see in moving the work forward. And without those two pieces, I don't know that the work moves. And so I just don't even have anything else to add to that.
Just a deep appreciation for all of your thoughts on this. And I want to encourage people in the time we have left to add some questions in the chat. And we have one already, which Brianna, is for you, I believe. This is from Tony. And Tony's question was, will there be any ballot initiatives in 2024 concerning reproductive rights? Excuse me.
There will be. I know of one for sure that should be coming. I don't know if I'm at liberty to say the state, though, so I'm not, just in case I'm not able to. But I do know that some states have been really inspired and motivated by what has happened in, some progressive states that have just affirmed that they want to make sure that abortion remains legally accessible in their state. But there have been some states like, I think it was Nebraska, that really pushed back on the legislature's efforts to restrict abortion access. And so I think we will see a ballot initiative in a state that currently has banned abortion. And we hope that it will be the 7th positive outcome for ballot initiatives. So for sure, there should be one coming next year.
Thank you. Other questions? The virtual chat doors are open.
One thing that I would also mention, not to step in your space, Brianna, is that Maryland has the Maryland Healthy Babies Equity Act. And so if anybody checks me on LinkedIn, you'll see that I actually just posted about this morning because I think it's phenomenal. And there, in that article, are data being quoted that demonstrates why the investment in prenatal care for people who are undocumented actually pays huge, huge dividends. So not only is it the right thing to do, but it is also, from an economic standpoint, it makes way more sense. And so if you all are looking to do something in this area, I think there's some good stuff in there that you can leverage and use to make the case in your own states.
Okay, so I'm scanning the chat to see if folks have any questions. And if not, I want to just take a moment to deeply thank our amazing panelists. This has been just an amazing conversation that took us from the morning to the afternoon, that has me buoyed, clear-eyed as we move forward in this work together, as we take collective action, as we think differently, hopefully, about sustainability, hopefully as we break for rest and dream, as we think about the arbitrariness of some of these self-imposed boundaries and how they harm us and don't allow us to work deeper together, and how we hopefully have some space for reflection during not just this panel, but through all of the different conversations that I know you've heard as part of this convening. I hope folks have been challenged, excited, fearful at times, not fearful, but maybe scared because they're hearing something different, and that it challenges them and agitates them to do something new and different. So I want to thank you all for making time for this conversation today. I hope it moved you and provided some of the information, guidance, or support that you may have needed today. So thank you all and have a great day. And thank you, Lee, Natalie, and Brianna. It has been an absolute privilege and a pleasure to have a small bit of time with you all to hear a bit of your collective genius thoughts. So thank you for your work, and thank you how you're moving.
I think there's one question actually in the chat now. For state partners that have different ideologies for practice, how have you helped folks come together pragmatically and sustainably rather than retreating to their own corners and doing this work in isolation of each other?
I'll say real quick, we've been using a process called V+V is the way that it looks on paper, but we actually worked with them to identify values in a more traditional sense, but what they actually value at a given time. And then we identify the intersection of that and use that as the point of interaction and engagement. So they may not agree on everything else, but if they have a space where they are valuing something similarly at a given point in time, that's where we try to get them to focus their energy and their attention. And then in that, we will often follow up by using reciprocity circles with asks and offers to say, it's literally a big circle that you draw. And inside the circle, people are asking for certain things. And outside the circle, people actually say, here's what they're willing to offer that can respond to what's being asked for. It gives them something that's actionable in a very short period of time that focuses specifically on the area of overlap for what is being valued in that moment. So that V+V activity has been really, really helpful at getting folks to recognize, well, we're the housing folks, or, we're the kids folks, or we're the health folks, or whatever it is. Oh, and there is an intersection of something that we value right now. And so one area and one coalition that I'm a part of, the Farm Bill is one of those areas where we find that there's so much in the Farm Bill that creates common value, that it's a great mechanism to get people to work together who maybe otherwise would not have worked together.
I'll just add extremely quickly. I also think about it like when we're talking specifically about like the inside game versus the organizing and the activism. That's the beauty of coalition work, right? Is that we don't all have to be using the same strategy. Instead, we leverage each other's expertise and skill and approach, all to approach the issue from all angles. And so I certainly would hope folks aren't working in their own corners. Bring your power as an activist or an organizer. I'll bring my power as a lobbyist, and then we will bring it together and affect change. And so I think that that's really the power of effective coalition building, is that you have all of these different strategies working together and in tandem.
Yeah. I think part of it is just like knowing each other, right? Like I had, I won't universally speak, but when I was working in North Carolina and there were tensions around inside the building versus outside the building strategies, it was 3 or 4 individuals who were particularly critical of our inside the building work. I made sure they had my cell phone number and that I had theirs, right? And honestly, like I said, like, let's be friends, right? Like we care about 95% of the same things. So let's like know each other and communicate. And that did help fix, I think, 95% of the challenges we had.
Thank you, Lee, who has our last word. Thank you, Natalie. Thank you, Brianna. Thank you, Tremanisha. So excited for our future together and the work that we'll continue to do. I hope everyone has an amazing day. Thank you for your time with us.